Hi everybody, Vijay here from 21D. We're going to talk about human anatomy today and how it relates to implant strategies, and particularly when we make full mouth prosthetics like these. Okay, this is what we standardly deliver patients when they come for full mouth implants, and it all relates back to the original status of a healthy skull. So as you can see, here is a healthy skull. And the ideal relationship is where it is a direct extension of the jawbone and the lower teeth sit behind the top teeth. This is called a class 1 relationship, and it's only the lower jaw that moves. So the upper jaw is fixed to the skull, it never moves, and it's the lower jaw that moves. And there's a load of muscles that interconnect to make all these movements and actions that we use both for speaking and for eating. So let's just talk about the skeletal part first. The further away you are from this point when you start, the more difficult your adaptation is going to be. When we calculate where you need to be, it's based on looking at it from the perspective of where things would have been in the first place. Now, the longer you've been away from where you should have been, the more adaptation on your part is required. One thing you need to be sure of as a patient is you need to understand and accept that you're going to have to put in the work to adapt. It's not going to happen overnight. It rarely does. But the good news is everybody does adapt. I've been doing this for over 2 decades and everybody does adapt. It's just a question of individual variable. So when we're talking about, for example, optimal balance of compromises, we have to work with what we've got left. We can avoid things like bone grafting, which is an additional surgery, which I prefer not to use. And in fact, I find far more success using native bone than grafted bone. Why? Because native bone is already attached to you and already has a good blood supply because it's part of you right now. And that's what we need for the process of osseointegration to happen. The prosthesis, as you can see, is designed not just to replace the tooth part, but is also designed to replace the lost gum, so we have an even gum line, and to support the lip behind it. Now, if you've lost teeth, for example, at the back on both sides for a long time, you can be pretty sure that the gum has grown into the space. So when I suddenly give you teeth back in these areas, you will start biting your tongue again. This is normal, because the tongue just hasn't caught up with the speed of change that we are delivering, but it will learn that once before you had a set of teeth like this. We pretty much all did to start with. And the further away you are from this, just remember, it is going to be a journey for you in adaptation. We will guide you all the way, but remember, it's a tight space, and the journey is to readapt to where you should have been, not where you are currently. Thank you very much.